Recent years, the medical community has become increasingly concerned about the long-term effects of opioid use, especially regarding cognitive health. Opioids are commonly prescribed for chronic pain, which affects a significant portion of the global population. While these medications can provide much-needed relief, questions have emerged about their potential to accelerate cognitive decline, particularly among older adults and vulnerable groups. As the use of opioids has risen worldwide, so too has the urgency to understand their broader impact on brain health. This video explores the latest research findings on the association between long-term opioid use and the risk of developing dementia, highlighting why this topic matters for patients, families, and healthcare providers alike. To investigate the link between opioid use and dementia, researchers conducted a systematic review and meta-analysis, carefully analyzing data from 9 observational cohort studies. These studies included patients who used opioids regularly and tracked their cognitive health outcomes over time. Pooled analysis revealed a significant association. Individuals with long-term opioid use had a 35% higher risk of developing dementia compared to those who did not use opioids. Importantly, this association was consistent across different geographic regions, suggesting a global relevance. However, the studies were observational, meaning they could not prove causality. Other factors might also contribute to the increased risk. Despite this, the findings underscore the importance of cautious opioid prescribing and regular cognitive monitoring for those on long-term opioid therapy. Might opioids increase dementia risk? Scientists believe several biological mechanisms could be involved. Opioids act on the brain's mu-opioid receptors to relieve pain, but long-term activation can lead to tolerance, dependence, and adverse cognitive effects. Research suggests opioids may disrupt brain plasticity, impair synaptic activity, and promote inflammation and cell death in the nervous system. These changes can affect memory, attention, and overall cognitive function. Additionally, opioids may alter immune responses in the brain, potentially contributing to neurodegenerative processes like those seen in Alzheimer's disease. While these mechanisms are still being studied, the evidence points to a complex relationship between opioid use and brain health, emphasizing the need for further research and safer pain management strategies. Findings from this systematic review highlight a crucial message for clinicians and patients. While opioids remain an important tool for managing chronic pain, their potential impact on cognitive health cannot be ignored. Healthcare providers should weigh the benefits and risks carefully, especially when prescribing opioids to older adults or those already at risk for cognitive decline. Regular cognitive assessments and open communication about possible side effects are essential. At the same time, more research is needed to clarify the underlying mechanisms and to develop guidelines that ensure both effective pain relief and cognitive safety. As the global population ages and dementia rates rise, understanding and addressing medication-related risks will be increasingly important for public health.